So when I came here with the idea of, living with my sister and taking my time figuring out my career. And instead I got handed a cancer diagnosis. And then it became a life-threatening cancer diagnosis. My name is Lourdes. I am 29. I work part-time as a digital literacy instructor, which is just a fancy way of saying that I teach computers to adults. One morning where I found something that wasn't supposed to be there and hadn't been there before. I was in the middle of moving from New York to here, so I didn't have a doctor, but I made an appointment with my sister's doctor because she was living here at the time. The doctor said it might not be anything, it could just be like, a cyst. She said it was better to check, which I think I really value that she did that. A lot of young people get dismissed. When I first went in for the ultrasound, when the ultrasound tech saw the imaging, they recommended that I go in for a biopsy. And that's kind of where I felt like things were serious. When I was initially diagnosed, I went in and I talked to my primary care doctor and I told her about, the news and asked her what should I ask? Because I really had no idea how to talk to an oncologist. I had MRIs, CT scans, and then I wound up having to get a PET scan. The PET scan showed that I had something in my lymph node on the right side. And that's when the possibility of stage 4 came up for the first time. I thought I had already been as scared as I could be, and I found out there was another level of scared. When I got diagnosed stage 4, I thought I was gonna die. I thought that was it for me. She explained to me that my treatment was gonna have to be hormone suppression and then my actual cancer drug. We started on a drug called Kisqali. So it's relatively new, but it was very specific to the type of cancer that I have. I was on that for 6 months. And then I was on Ibrance for almost a little bit over 2 years. I had a mastectomy, I've had radiation. The radiation made a little bit of cloudiness in my lung. So we were doing a follow-up scan for my lung. When we did the follow-up scan, we found that there were 2 nodules in my lung. Again, it was another kind of moment of shattering. So my doctor had strongly recommended I get into a clinical trial because it was my best chance of trying something new, and she helped me find the trial at Jefferson.
So trial drug, which is samoraciclib, is a small, potent molecule and a selective oral inhibitor of CDK7. CDK7 is an important target in oncology. We found that when we combining samoraciclib, which is the CDK7 inhibitor, with fulvestrant, there's a synergistic effect.
I've been in the trial for about 2 months, so now it's just a matter of finding out if it's working or not.
I'm currently in the process of launching a multi-D young breast cancer clinic with a hope to address the challenges they face and also to offer an essential guidance for them.
There's a lot of really specific challenges as a young adult diagnosed with cancer, specifically metastatic breast cancer. While I was watching my friends advance in their careers and get married and go into committed relationships and have kids, I was spending a lot of time just navigating my diagnosis. I think it was really, really difficult to have this really sudden flip on my life, being afraid of dating because I have to tell this person that I'm living with what's essentially a terminal illness. It's an illness that's going to be with me until I die. In the course of my diagnosis, I've, come to realize things about my gender. My sexuality was kind of something that was already clear to me, but my gender became more clear to me. I think that piece has been a little bit harder to talk about with my healthcare providers. The way I've been approaching this trial is knowing that it's not just for me, it's for other people who will come after me. I think every patient should have the option of something that is as specific to their type of cancer as possible. And we can't get there without the funding for the research.